Good morning, everyone. My name is ZHENG, and I'm honored to share the finding of a study I co-authored with Dr. Yu Yu, an associate professor at the Hong Kong Metropolitan University. The topic is socio-ecological lens on the impact of urban planning on the health behavior in Asian Pacific region, an integrative review. Dr. Yu's research mainly focused on the elder people care and the social-ecology, which provide the theoretical foundation in this study. While we try to focus on the Asian Pacific region in this study, it's because home to 60% of the global population are living in this area, but unfortunately, this area is under the rapid urbanization, and its environmental pressure and economic disparity is very strict. This problem may lead to the public health concerns such as the raging chronic disease, the increasing mental health issues. We can see in these figures, the population density in the different cities is very different, and urban issues is very strict now. So we try to use a socio-ecological framework to adapt this study because it can provide the comprehensive analysis to interface the interaction between the urban planning and health behavior across the individual, the interpersonal, the organization, and the community and the policy level. This SEF is widely applied in the Western context, but the study in the Asian Pacific region is still limited. So we use this SEF to make the integrative review to adapt the different type of the research to fill in the research gap and make some policy implication. The first step, we use the different paper from the PubMed of Web of Science, the Google Scholar, measuring the urban planning and the health behavior change. The health issue may focus on such as the SARS, the COVID-19, the smoking section, the women health, etc. After selection, 181 study was included in this review and conduct a qualitative context analysis to categorize across the SEF in the individual, the interpersonal, the community, organization, policy, and the information level in the Asian Pacific region context. In the key finding, the individual level shows that the personal factor like age, education, and mental health shape the health behavior. For the instance, the race perception, the education, and economic condition also can encourage the health behavior. The next, in the interpersonal level, the social and family network play a major role. For example, a strong parent-child interaction can promote the better psychology and the mental health across the family. Then the community level focus on the broader factor like the density and the local culture. At the organization level, access to the healthcare system is quite important. Government investment regulation also play a major role in the policy level. Finally, at the information level, accurate information and effective communication is very important to help people to make their positive health practice. The review comprehensively analyzes the relationship between the urban health and through the SEF and fill a significant knowledge gap in the existing research. From our review to adapt this challenge, we recommend to design the cultural inclusive public space, encouraging the family activity, and using a data-driven intervention to target at-risk population. Lastly, in improving the access to the health information through the different technology can empower resistance to make a easier or health decision. In conclusion, this study highlights the importance of using a socio-ecological lens to address the unique challenge in this area. By recognizing the interaction between the individual, interpersonal, and multi-level factors, the urban planning can play a transformative role in the promoting the health behavior and improve public health. Thank you very much for your listening, and I'm happy to take any questions.